I want you to imagine for just a moment that you are looking at a hidden epidemic.
Right.
We are talking about an epidemic that is quietly affecting over a third of the United States population at any given moment.
Which is just a massive number.
It really is. And it's an epidemic that is currently costing the American healthcare system billions upon billions of dollars, like every single year.
Yeah.
And yet, if you turn on the evening news or, scroll through your social media feeds, you are far more likely to see breathless, wall-to-wall coverage about a single isolated case of a tropical virus.
Oh, absolutely. Or, the seasonal flu.
Exactly, the flu. You'll see that way before you hear a single substantive word about this massive, sprawling health crisis.
It's basically the ultimate elephant in the room of public health.
Okay.
I mean, we are dealing with a category of disease that is so pervasive, yet so deeply shrouded in societal stigma and, well, personal embarrassment,
Yeah.
that we have essentially agreed as an entire culture to just simply look the other way.
Right, like it doesn't exist.
Exactly. We don't talk about it at dinner parties. We don't bring it up casually with our primary care doctors. And the pathogens responsible are just absolutely thriving in that silence.
Welcome to the deep dive. For this exploration, we are pulling from two incredibly revealing sources to kind of crack this open for you.
And they complement each other perfectly.
They really do. So first, we have a national report filed by CBS News. This report utilizes broad, sweeping data directly from the Centers for Disease Control and Prevention, the CDC.
Right, so that's the big picture.
Exactly. That gives us the terrifyingly large macro view. But then we are pairing that national overview with something much more surgical, much more granular.
Which is where things get really fascinating.
Oh, totally. We have a highly specific, totally eye-opening retrospective study from the Johns Hopkins University School of Medicine. The researchers there analyzed tens of thousands of actual patient visits to two urban sexually transmitted disease clinics right in Baltimore, Maryland.
And, the contrast between those two sources is really what makes this analysis so necessary.
Yeah, how so?
Well, the CDC gives us the sheer staggering volume of the problem from, 30,000 feet up. But national aggregates often hide the truth of what's actually happening on the ground.
They smooth everything out.
Exactly. The Johns Hopkins study gives us the human behavior. It shows us the nuanced reality of who is actually walking through the clinic doors. And more importantly, it forces us to confront some of our most deeply held fundamental assumptions about aging and risk.
And that is exactly the mission for today. We are going to look at these staggering national numbers of sexually transmitted infections, or STIs, but we aren't just going to list a bunch of statistics and, leave you feeling overwhelmed.
Right. No one wants just a list of numbers.
Definitely not. We are going to zoom in and completely shatter a major societal assumption. We're going to explore the surprising and incredibly misunderstood world of STI risk factors among patients aged 50 and older.
It's a demographic that usually just gets totally ignored in this conversation.
Completely ignored. We are going to look at why our medical system is failing them and why the predictors we rely on for young people completely fall apart as we age. Okay, let's unpack this.
Starting with the national picture.
Let's lay the groundwork. To understand the anomaly of the older demographic, you really first have to understand the baseline reality of the country as a whole.
Because the silence surrounding STIs is actively allowing the pathogens to win, right?
They're absolutely winning, without a doubt.
Yeah, when you look at the numbers from the CDC data via that CBS News report, they are laying out a scope that is honestly just hard to wrap your head around.
It is.
At any given time in the United States, there are 110 million Americans living with an STD. I just want to pause on that for a second. 110 million people.
To contextualize a number that large, think about your daily commute.
Okay.
If you were sitting on a subway car or waiting in line at a busy grocery store or sitting in a crowded movie theater, statistically more than 1 in 3 adults around you is currently carrying a sexually transmitted infection. Wow. 1 in 3.
Yeah. It crosses every demographic, every geographic boundary, and every socioeconomic status.
The breakdown the CDC provides is really fascinating because it shows just how universal it is. They note that there are about 50.5 million current infections in men and 59.5 million in women.
So it's slightly tilting toward women in terms of total burden, but it really is everywhere.
Yeah, everywhere. And that is just the concurrent cases, like the people who currently have one right now. The CDC also highlights that there are 20 million brand new STD infections occurring every single year.
And adding 20 million new cases to the public health burden annually it creates a massive structural strain on the country.
I can imagine.
Aside from the human toll,
Mm-hmm.
the physical pain, the risk of permanent infertility, the long-term systemic health consequences, there's just a crushing financial burden.
Right. The report mentioned the costs.
The CDC estimates that these new cases cost nearly $16 billion a year in direct medical costs.
Okay, but what does that $16 billion actually pay for? Because, I imagine a lot of these infections are just cured with a quick round of antibiotics, right? That doesn't sound like it should cost billions of dollars.
That is a very common misconception.
Oh, really?
Yeah. I mean, yes, a course of azithromycin for a simple bacterial infection is relatively cheap. But that $16 billion isn't just paying for basic antibiotics.
What's it paying for, then?
It's paying for the massive infrastructure of screenings and laboratory testing. It is paying for the complex, long-term antiretroviral therapies for viral infections.
Oh, sure, the lifetime medications.
Exactly. But most devastatingly, it is paying for the advanced stages of untreated infections.
When people don't catch it early.
Right. When a bacterial infection goes undiagnosed for years, it causes pelvic inflammatory disease, which requires hospitalizations and surgeries. It causes ectopic pregnancies. It requires complex neonatal care when infections, like syphilis, are passed from a mother to a child during birth. The cost of managing the damage of an untreated infection is astronomically higher than the cost of just a pill.
Okay, that makes a lot of sense. The delay in treatment is where the real cost lies.
Exactly.
So what exactly are the specific diseases driving this $16 billion, 110 million person crisis? The CDC outlines what we could call the Big Eight.
Right, the usual suspects.
Yeah, these are the most common STIs fueling the numbers. Chlamydia, gonorrhea, hepatitis B, genital herpes, HIV, human papillomavirus, which we mostly just know as HPV syphilis, and trichomoniasis.
And when we look at the Big Eight, we really have to divide them into different biological categories to understand how they actually operate.
Okay, break that down for us.
Well, some are viral. That includes herpes, HIV, HPV, and hepatitis B. Viruses, they basically integrate themselves into your body's cells.
They become part of you.
Yeah, exactly. For many of these, like HIV and herpes, they stay with you for life. They require ongoing, sometimes daily medical management to suppress the viral load and keep you healthy.
And the other side of the coin, the non-viral ones.
The others are bacterial or parasitic. That includes chlamydia, gonorrhea, and syphilis, which are bacterial, and trichomoniasis, which is a parasitic infection.
Okay.
Biologically, these are invading organisms that do not become part of your cellular structure in the same way viruses do. Therefore, they can usually be completely eradicated, cured with targeted antibiotics or anti-parasitic medications.
That sounds like good news, though.
It is, but, and this is the massive caveat, they can only be cured if they are actually diagnosed.
Which perfectly sets up why these numbers are so outrageously high. It's what I've been thinking of as the asymptomatic track.
Yes, that's exactly what it is.
The CBS report makes a huge point to emphasize this. Infections persist for a really long time, sometimes years, because a massive percentage of the victims have absolutely no idea they are infected.
They feel totally fine.
Right. Their bodies do not give them a warning sign. They have zero symptoms. No pain, no rash, no fever. So they just go about their normal lives, forming new relationships and unknowingly transmitting the pathogen to others.
And the biology of the asymptomatic infection is, well, it's an evolutionary masterpiece from the perspective of the pathogen.
A masterpiece.
Really, it is. If an infection immediately makes you terribly ill, you stay home in bed and you don't interact with anyone.
Right, you isolate yourself.
Exactly. So the pathogen hits a dead end. But a pathogen that can replicate inside your mucosal tissues without triggering a massive, painful immune response, that pathogen gets a free ride.
It just hitches a ride.
Yeah, it gets to travel with you completely undetected right to your next partner.
And chlamydia is sort of the poster child for this, isn't it?
It really is. The CDC notes that chlamydia is the most commonly reported infection overall.
How common are we talking?
Well, in 2012 alone, the data shows 1.4 million reported cases. That translates to a rate of about 457 cases per 100,000 people.
Wow.
But the operative word there is reported. Chlamydia is famously known as a silent infection. It is highly adept at evading the body's early alarm systems, particularly in the female reproductive tract.
Because there's no warning sign.
Right. Because it doesn't burn, because there's no visible lesion, People simply don't seek testing unless it's just part of a routine screening protocol.
Which a lot of people don't do.
Exactly. So the actual number of circulating chlamydia cases is undoubtedly far, far higher than 1.4 million.
So let's talk about the demographics of those new infections. When you watch national media campaigns or look at public health funding, they have a very, very specific target audience locked in their sights.
Oh, absolutely. Teenagers and young adults.
Yeah. The data shows that 50% of all new infections occur in young people, specifically the 15 to 24 age bracket. Gonorrhea, for instance, is the most commonly reported STD in that specific age group, even though it's second nationally behind chlamydia.
The sheer volume of new bacterial infections in that 15 to 24 demographic is just overwhelming the system.
It's massive.
Meanwhile, the report notes that new infections of the most severe viral pathogens, HIV and hepatitis B, are relatively lower by comparison. They sit at less than 50,000 new diagnoses each year.
Which is still a lot, but
Right. 50,000 new HIV cases is still a tragedy and a major public health priority, but numerically, it is a drop in the bucket compared to the millions of chlamydia and gonorrhea cases spreading through high schools and college campuses.
yeah, if I'm a public health director and I'm staring at these national CDC numbers on my desk, the strategy seems obvious.
You target the youth.
Right. I look at that 15 to 24 demographic and I say, that's our battlefield. That's where we buy the billboard space. That's where we distribute the free condoms. That's where we pour all our sexual education funding.
It makes complete sense on paper.
Based strictly on that macro data, it's a completely logical conclusion. But this is exactly where we need to pivot. We need to leave the national overview and dive into our second source, the Johns Hopkins study.
Because that study flips everything upside down.
It really does. Because when researchers actually looked at who is sitting in the waiting room of a clinic, the narrative completely fractured.
The Johns Hopkins research team understood that national aggregates can be incredibly deceptive. Like we said, they smooth out the edges of the data.
Yeah.
To really understand the mechanics of transmission, you need to look at a microcosm. They chose Baltimore, Maryland.
Why Baltimore?
Baltimore is a critical environment for this kind of deep dive because it represents one of the highest STI morbidity areas in the entire United States. It's a dense urban setting with complex, overlapping public health challenges.
So it's basically a perfect testing ground.
Exactly, making it a perfect laboratory to study how these diseases actually move through a population.
I want to highlight the scale of this study because it's not some small, 100-person sample size.
It's massive.
The researchers pulled data from a huge electronic medical records database. They looked at visits to 2 urban STD clinics in Baltimore over a 5-year period, from 2005 to 2010. We are talking about over 183,000 patient visits.
It is a mountain of clinical data.
It is. But instead of just confirming the narrative about teenagers, they did something totally different. They isolated a large, randomized sample of younger patients, anyone under 50, and set them up against a cohort of patients who are aged 50 and above.
And let's get into the methodology just a bit here because it validates their findings.
Yeah.
When you have 183,000 visits, you have a lot of noise. You have people coming in for repeat checkups, follow-ups, false alarms.
The same person coming in 5 times.
Right. So the researchers filtered that data specifically for first-time visits during that 5-year period to ensure they had clean, distinct patient profiles.
Oh, that's smart.
Very smart. And after that rigorous filtering, they ended up closely analyzing 4,893 visits for patients under 50 and 4,461 visits for patients over 50.
So they essentially have 2 massive, evenly matched armies of data, almost 5,000 younger patients and almost 5,000 older patients.
Yes. And what they uncovered when they compared those 2 cohorts, it completely shatters the deeply entrenched narrative that STIs are exclusively a young person's problem.
Right, because the media just obsesses over the college hookup culture and, teenagers navigating dating apps.
Constantly.
But the Baltimore data pulls back the curtain on a totally different graying frontier of sexual health. And to even begin to understand what's happening in that older demographic, we have to start by tackling the biggest psychological hurdle in the room.
Which is?
We have to talk about the myth of the asexual senior.
Ah, yes. This is a profound sociological issue.
It really is.
There is this pervasive, almost comical assumption built into our society that once people hit a certain arbitrary age milestone, say 50, 60, or certainly 70,
right,
they simply pack up their sex lives and put them in the attic along with their old careers and their kids' baby clothes.
Right.
We treat the aging population as if they are somehow biologically neutralized.
Yeah, and if you're listening to this right now, I want you to be totally honest with yourself. When was the last time you thought about your parents' or your grandparents' sexual health?
Probably never.
I'm guessing the answer is never. In fact, just me bringing it up probably caused a little spike of discomfort for you.
It's an uncomfortable truth for a lot of people.
Yeah, and we use that discomfort as a societal defense mechanism. We just don't want to think about older adults having active, potentially messy, complicated sex lives.
But the data from the Hopkins study and the nationwide behavioral surveys